Hello everyone, I'm Jo Hopkins and I'm Programme Director for Adverse Childhood Experiences, Criminal Justice and Violence Prevention in Public Health Wales. And today I'm just going to talk to you a little bit more about what in Wales we are doing to develop ourselves as a trauma-informed nation. So I think one of the first things to start with is that Wales, in developing a trauma-informed nation, is looking at bringing together a number of key programmes that have been funded by the UK government, by Welsh government, and have now been embedded and sustained in Welsh policy and practice, bringing them together so that we can confidently break the cycle of adverse childhood experiences, look at things like competent and confident workforces that use compassion, enable a whole system response to vulnerability through trauma-informed approaches, work together to prevent violence through a public health approach, and address the structural determinants of violence, abuse, trauma and health inequality. So we have 3 programmes here in Wales, one that looks at early action together, police and partners multi-agency response to looking at how we can break the cycle of ACEs. We also have the Home Office funded Violence Prevention Unit, which you will hear more about, I'm sure, in other presentations, which is also thinking about prevention, mitigation of violence in Wales. And we deliberately took the form of prevention rather than reduction, because we really want to emphasise the importance of starting at that point. And then we have the Adverse Childhood Experiences Support Hub, which is the Welsh Government funded programme, which has been going now for the last 4 years and has just received funding to continue. And that looks at the devolved contributions of services, of communities and of Welsh society in becoming ACE aware and trauma informed. So we have a unique setup here where we have something that is funded by the Welsh Government, but also programmes that are funded by the UK Government coming together. And the integration of these programmes is key here, because it's about all public services, one public service, striving to work in the same direction to prevent ACEs from happening in the first place, support early intervention where we know that there might be risks to children or to families, and think about what might need to be done there, which may not actually mean diversion to services, might be a more signposting to support, that sort of thing. And then trying to establish really what we can do more to make sure that communities have resilience or have access to protective factors, which means that when ACEs occur, that people are able to find those areas of support to help manage and to overcome any adversity that happens. So that's what we're doing. We're bringing it all together into one shared ambition, one shared vision for Wales to become a trauma-informed nation. Before I go into more detail about what we've actually delivered, I think it's important for the audience here to understand what we mean by the words trauma-informed. There's a lot of discussion at the moment around adverse childhood experiences and the research, which is great, but actually turning that research and what we know into practice is slightly more challenging. And we think we've moved into a phase now of calling that practical application of our knowledge a trauma-informed approach. And it's become quite clear, and you'll probably hear different presentations over the course of this conference, that trauma-informed actually may mean different things to different people. And there are different levels of intervention. The universal level, which is what we're talking about in the programmes that I'm describing in Wales, up through a more clinical pathway to people who need medical interventions and proper medical support in terms of dealing with trauma. So we have a range really of different elements that need to come together, and it's really important that we understand which part of that we're talking about. So for us, when we talk about trauma-informed approaches in Wales, it should encompass all of that, but in terms of the programmes that are delivering, in terms of the Early Action Together, the ACE Support Hub and the Violence Prevention Unit, what we are doing is looking at that more universal offer, the more, what can we all do to ensure that we recognise that people may have experienced adversity, and how do we do that? So the principles of trauma-informed care is what we stand by in terms of that trauma-informed principle, having safety at the heart of what we do, so ensuring that we have physical and emotional safety in our workplaces or in the people we interact with, ensure that there is choice. So providing options and control for people who want choices, people who've had control taken away. This is really important. It makes a really big difference to feel that you are able to decide and determine what happens. Collaboration, make sure that we're not doing this in silos or working alongside each other and not maximising those opportunities that collaboration brings. Empowerment, again, building that sense of being in control, having the skills to be able to do the things that we want to do. And trust, one of the most important aspects of this, developing a trust between who the people we work with, people we work for, and the people who are in our environment around us, and for ourselves, so that we all know that we are going to be able to work together in that way. So what does this mean in terms of operationalising this in Wales? So if we have a shared understanding of what we mean by trauma-informed at that more universal level, what are we asking everybody to consider and think about when we work in this way? And what we want to try and do is to get a sense of understanding where organisations already are, to know where they need to focus in order to become more trauma-informed in practice. So we have a number of resources in the Adverse Childhood Experiences Support Hub, which we have been working with organisations to test and to pilot, to really understand what it is that they need in order to become more trauma-informed in practice. So there's a skills and knowledge framework in Wales, which sets out some of the things that organisations and individuals need to consider. We also have a toolkit which enables organisations to look at, as I say, where they are on this journey, a self-assessment of what it is that they are doing and where they need to focus effort, and then to think about what they could bring in to service those resources, to think about where those needs are and what organisations they could work with to do that. And that includes universal training as well, which is part of our offer and a number of resources that the Hub has developed to support that, but also perhaps some specific areas where certain workforces or certain people that organisations work with might need to be thought about in that context. So what would need to be delivered in terms of training? How would it be embedded in the ethos of the whole organisation? It's about cultural change as well as ensuring that people are aware of what ACEs are and how to mitigate them. So these resources are available on our website, www.aceawarewales.com, and freely available to everybody to have a look at. But as I say, we are working through with a number of organisations to really test the process that we've set up here and really understand how we can best support them to really kind of operationalise what we're all trying to achieve. And we've got a number of examples in the Adverse Childhood Experiences Support Hub of the work that we've done over the years to really help work with sectors to achieve not only an understanding of what ACEs are within their workforces and with the people they work with, but also to think more about what is that practical application and what difference can it make. So here's a slide that just tells you a little bit more about some of the areas that we've been working with housing and homelessness, with an additional grant from Welsh Government to deliver psychologically informed environments, which I'll talk about later, with youth services and youth justice, a large programme of work with education, looking at ACE awareness and trauma-informed practice in schools, both primary and secondary, and we're currently looking at further education and higher education in this space. Also thinking about our communities and how we can develop ACE awareness and trauma-informed practice through things like sports participation, with a particular programme of work called It's Not Just About Sport, thinking about building that resilience, giving access to children to those protective factors that they might need, such as a trusted adult or a connected community, to really ensure that they have the things that they might need to cope with what they're experiencing. And also thinking more about our communities at large and our society and what we might be thinking about in terms of developing a trauma-informed community approach, and more on that a little bit later in terms of the work we're doing in North Wales. And as I said, we have a multi-million-pound programme which was funded by the Home Office called Early Action Together, which was really looking at the policing criminal justice response with multi-agency input, particular with the work of Bernardo's to think about how we transform that area into trauma-informed approach. So just focusing on that last one for a second and thinking about what could be achieved in the criminal justice space. I think it's worth just reflecting on what the objectives and core principles are of the Early Action Together programme, which, as I said, was delivered over a number of years. The last year, over 2019 to 2020, was really a consolidation of all the work that had gone into developing this approach with the 4 police forces in Wales, with HMPPS and with partners such as Barnardo's. So just to kind of inform you of where we started with this and what the objectives were. There were 4 key ones, which are about developing that competent and confident workforce, having that organisational capacity and capability to respond to vulnerability, looking at a 24/7 connected response to signposting, supporting and safeguarding people, and having a whole system approach. They're the key principles for which we were working. And some of the things that really stood out with this programme, I think, is that from the outset, it was very clear that we are working with systems and not with the symptoms. We need to think about those systems, who's in them, who they are, what they are, and understand the impact of change and what that means for the people who are operating within them, and also trying to seek support within them. And really understanding that this is about people, putting people at the centre of what we do. Although we are all so used to working with processes, actually, do we have a process that makes a difference to an individual? That's the question we need to ask ourselves with this, and putting their needs at the forefront. I was also thinking about, one of the common problems that we face when you have a funded programme is about what should we do? What should we do more of? Well, actually, we've got a lot of stuff that's already in train, already being developed. So could it not be a better way of doing it, to think about what we do differently with what we've got, rather than just doing more of something that may not be working? So taking that public health approach, looking at the evidence of what works, looking at what's been tested, trialled interventions, and being brave enough to say, no, we're not going to continue with that because it's not delivering the impact or the outcomes that we are trying to strive to achieve. And that's the point about being led by evidence and not by assumption, because what this is underpinned by is the Public Health Wales research, but also the evidence and the research of what's worked as we've gone along. And there's a whole suite of evidence that's available on the website for Early Action Together, on the Royal Society of Public Health, which will let you understand what those key elements are and how they were evaluated and assessed. So I really urge you, if you're interested, to go and have a look at that. And the final one is about building into, not onto. Again, this point about we don't want to just pile stuff on top of something that already exists. We want to look at that and understand what more needs to be contributed to it so it can work more effectively. And the programme was delivered over 3 years in total, and has delivered some real successes, which I just wanted to share with you today, because in terms of the law enforcement and public health agenda, I think some of these key successes are things that, okay, has been done in Wales, and we have the Welsh context, we have the Welsh legislation that supported us to do that. But actually, we think that these successes are things that could be upscaled to anywhere that's looking to introduce an ACE-aware or trauma-informed approach to policing and criminal justice. So through the training delivery, through the development of different services and pathways, and through the testing of different models, here are some of the things that we think show the success of this programme. So we have police and partners reporting an improved knowledge and awareness of ACEs and increased confidence in working with vulnerable people. We've had results where officers have been submitting much better quality safeguarding referrals, fewer insufficient or unnecessary referrals, and more referrals being made directly to help provisions, to early help provisions. So this is about reducing the endless paperwork, the referrals that get pushed up and then pushed back down again because it didn't have the right information, or actually were not being pushed in the right direction in terms of the help that they needed. There's an increased collaboration with partners to look at that integrated front door. So what does it mean if we say an integrated front door? Who are the people that you expect to be behind that? So if you ask for help, do you get that right support at the outset? And then building onto local systems and processes. So the programme supported by police and partners to really transform how help and support is provided so we can reach people at the earliest possible occasion. One of the key areas for us as well was thinking about that well-being of our workforce, not just about the people that we're supporting, people that we're there to serve, but actually police and criminal justice staff themselves. So it was great to see that we have evidence that staff felt that well-being initiatives help them to address stigma such as mental health and other problems around self-care in the workforce, as well as thinking about the impact on the wider community. And there's a specific piece of research that can be found, as I said, on the website that looks specifically at that aspect. There's also the wider community impacts and how that creation of ACE-aware families and communities supports the ambition to break that intergenerational cycle of abuse or of crime. So really helping people to understand what has happened and how they might fit into that and think about how they can support themselves and others. The development of a whole system approach to prevent and mitigate ACEs with multi-agency trauma and ACE-informed approaches delivered in criminal justice and youth justice settings. So this isn't just about a programme that's talking about policing, it's much broader than that, and is actually going on now to inform further work in violence prevention, as I said, the violence prevention unit, but also in other areas of the criminal justice system. So taking the foundations, taking the learning, and then developing it within the context of that environment. And actually, we've seen that costs can be avoided through taking this approach. So looking for alternative early help pathways actually takes away the resource requirements on police and criminal justice agencies if people actually get the support that they need rather than entering into the criminal justice system. One of the key areas that I mentioned as part of the Early Action Together programme was also thinking about communities. And one of the thematic areas for Gwent Police Force in particular was thinking about education and how policing and criminal justice can work better with schools in the local community to really understand how we can support children who come from homes perhaps where they're experiencing adversity. And one of the programmes within that is something called the Headley Back in Welsh, or mini police, where we have young people and children being part of a programme where they can understand a bit more about what it means to be a police officer and how they can support themselves and their community. And what's really nice about this is that many of these children have actually had, and their families may have had some experience with policing and criminal justice. And actually the involvement of the children has really changed the mindset of those communities and understanding that police are there to help and support as well as to enforce the law. So we've been really pleased with the outcomes of that in terms of changing some of those cultural and sort of ethos-driven perspectives. But also, it has been a real driver for the Welsh Government. Of course, education in Wales is their responsibility to really ensure that all schools in Wales have access to adverse childhood experiences, research and knowledge, but also that practical application of trauma-informed practice. And we're really pleased to have developed a model that has reached 2/3 of schools across Wales, but it is a train-the-trainer model, so it will continue to deliver now for schools to help them to become more trauma-informed in practice. And we can see some real outcomes from that in terms of we understand that schools who are taking that approach actually see less absence from children, both in terms of health outcomes, but also in terms of more compliance with the school system, which is really important because if children in school, then they're less likely to come into contact with anyone who might seek to exploit them. So we wanted to really do some further work to see how much impact that has had over time. And as I mentioned earlier, one of the other key success areas has been around housing and developing a psychologically informed environment. So here is about looking at the relationships that staff have and the support they have and training, creating that environment which enables people to work in a different way, having a framework of delivery, gathering evidence and thinking about how that practice changes the outcomes that you're looking for. And in 1 year of working like this, we saw some tremendous outcomes in terms of reduced numbers of interventions from emergency services, lower eviction rates. There's a real set of really positive outcomes from just working a different way. But the key for this, though, is thinking about not just doing a training course. This was about transforming the system and thinking about all staff from the chief exec right the way through to the people who provide the administrative support and all the others that are part of the organisation to deliver this. So it really is about transforming. It's not about just training. And this example, I think, is one that's really strong, that shows what can be achieved. And then back to the Early Action Together programme again, just to kind of emphasise really some of the key outcomes that can really be achieved through developing this approach. So an example of someone who's come into contact with the criminal justice system may have been treated differently, looking at what they've done in terms of criminal acts. Access to support is limited. There's elements of personal self-harm and abuse, etc. And when you look at it from a different perspective of how people are treated, by asking them what's happened, by understanding some of those causes, by thinking more clearly around what might be an alternative avenue of support for that person, rather than criminalising them and putting them into a system when there may be other options for support. And by doing so, and by taking that different approach, what we see is actually a 36% reduction in time that police and partners spend for people, but also a 66% reduction in costs. So people getting the service that they need, people getting the support they need, but also there is a reduction of demand and cost for the police themselves. And just to kind of round up now with all of these areas of work, as I said, big programs, big transformation programs, lots of activity, research, evidence, and all the rest of it. And as I say, you can have a look at that research on www.aces.me.uk, and you can really see the breadth, including the overall evaluation of the programme, of what can be achieved. But one of the things that I think is often the question from these big programmes is, well, that's great if you can evidence and demonstrate some of the bigger behaviour change aspects of it, but what are some of the tangible outcomes? What are the things that could be delivered that are scalable and could be delivered in police forces in this case, or organisations across the UK and internationally? So we've got some really tangible models that have come out of that we do think are scalable outside of the Welsh context. For example, North Wales Police developed early help pathways with partners, shared referral mechanisms, and looked particularly at the elements of social prescribing, which is really interesting in terms of thinking about what services people might need, which is actually different from prescribing drugs perhaps to support needs, and thinking more about different alternatives. Gwent Police Force looked particularly at the 24/7 integrated front door model and a multidisciplinary control room intervention, so having social work staff within the police control room, early help hubs, and the education thematic, as I'd said. Dyfed Powys Police Force really focused on that enhancing resilience and self-care in the workforce element, thinking about how we can reduce things like the stigmatisation of mental health, support people within the workforce to understand what they're dealing with, understand how they cope with it, and put things in place to support that. And then South Wales in particular were developing a police model for responding to vulnerability, so thinking about that response to crisis, and again that integrated model of social workers in the control room, piloting that, trying to reframe really how we view the vulnerable people that access our services. And finally, it's our ambition, as I said at the start, to pull all this together really and think about what does this mean for Wales in terms of our communities and our society. So our ambition is to have an integrated model and approach in Wales that demonstrates really how we are trauma and ACE informed as a community. So we've got the shorter term models, the learning from these programmes, trying to develop an understanding of what more we could do to help sectors, organisations, individuals become more informed about ACEs and trauma-informed practice. And then we lift that up to the community level. So thinking about developing on the time to be kind ambition, compassion, engagement, trying to understand more about the use of language and getting that common understanding of what trauma-informed actually means, recognising community assets and the strengths that they already have, and then building into those the concepts I talked about earlier, thinking about what we mean by community, what does that look like, putting resilience front and centre. So when I say resilience, thinking about those factors, those protective factors that enable people to cope with the adversity that they face, and how there should be equality of opportunity to access them. And then as you go from the medium term into the longer term, upscaling this and adapting this. Not every community or not every region is going to be the same. You need to think about the context, you need to think about the governance, and you need to think about what that community actually says it needs, and what it's already doing. So all of these are work that is being developed at the moment around North Wales in particular, where we're working with Wrexham Glyndŵr University, and a movement that's based on equity and equality of access to health, and really trying to think about how we expand our knowledge from across all these programmes to really develop that community response. And I think one of the things is that, you know, at the front and centre of what we do is understanding that the communities themselves know what they need, what they want, and what they can achieve. So it's no good doing to people. It's no good coming along and saying we know best. It's about putting that power back in the hands of the community, and from that, really driving forward awareness of adversity and childhood experiences, but also a response from the community based in compassion, kindness, and developing trauma-informed practice. Thanks very much.